Welcome to another episode of the Your Company Health podcast. My name is Andrea Wright. Today we have a special guest, Mr. Terrence Hight Jr. of the Hight Effect and Hight Health. Hey Terrence, how are you?
You're doing great, doing great. How are you today, Andre?
I'm great, and I'm excited to have you on because I know the great things that you're doing in the community, and I know you will definitely, talk to our listeners about this and how they can actually even help you to advance what you're doing. So first of all, I want you to tell us your story.
Yeah, absolutely. So I've pretty much been an entrepreneur the entirety of my life. I started off with like a detective service when I was like 8 years old. And then that turned into, of course, a grass cutting business. But I really got serious about it around my sophomore, junior year of college when I started my first LLC, and it was in the music industry. I wanted to be there in the music space, but then kind of realized my 9 to 5 was healthcare. And that's when I realized there were so many gaps. So in 2015 and into 2016, 2017, started my first healthcare tech company called Connected Care. And what Hight Health is, which was officially started last year, is like the third version of that. So it's that entrepreneurial journey of still trying to connect people to care, but in different ways. So that's where we are today with Hight Health, connecting people to care and providing that access to care in communities.
What is Hight, the Hight Effect? Talk to us about that.
Right. So the Hight Effect, that actually spun off when I finished my executive MBA, and I came out and realized there's a lot of businesses that were startups or people that wanted to create startup companies but didn't know how to do it. So I said, how can I give people that didn't go to business school, how can I give them those key skills that make corporations big? Because I think there's value in, MBAs and that level of knowledge. So that's where the Hight Effect started. Is a consulting firm for small businesses, and that's very much alive. So that's the other end of what happens in the background, and that's actually how Hight Health started. I test different business ideas with the Hight Effect, and then the ones that ended up taking off, I turn them into actual entities and make them businesses.
Awesome. So Terrence, why healthcare though? Because I've spoken to a bunch of healthcare entrepreneurs and doctors, and sometimes it's a aha moment or something happened in your background that push that burning desire to channel to be channeled in that area. So was there a story behind healthcare?
Yeah, somewhat. So my dad had been in healthcare my entire life. So I literally grew up in the hospital. Like when I was 15, I worked as a volunteer in the hospital, and then just throughout time, just being in the hospital. So I've been in healthcare majority of my life, and I needed a job. I just got married. I was, in my early 20s and all that, needed a job. I ended up working at a hospital and realized, wow, I really like this. One, two, I realized that the impact could be so great because it was such a big need. And then I realized too that there are a lot of communities that are not receiving some of the resources or getting a level of resources that are not really helping them stay healthy for a long time. So just over time, I saw that my focus should be in that space. And then just being, an actual healthcare employee working in hospitals and with insurance companies and consulting firms in the healthcare space for over, a dozen years now, I've been able to really dig deep and see, hey, there's problems that we can really fix with people, who look like me, for people and patients that look like me.
Awesome. And Terrence, I want to say, man, I really commend you and your company for what you're doing in the community. But I want you to talk to us about how do you do this?
Yep, so our process, absolutely. So we do it through 3 ways: either health fairs or health events. We like to call them community health events, where we actually bring all these resources into the community. We have another event actually next Saturday, July 16th, at Paradise Church of God in Christ in Forest Park. But we bring the different health providers to the communities and provide things like free screenings, free health education classes. This will be a health advocacy event. So we'll have not only free screenings and things like that, but we'll have people who are health experts and physicians talking about, how to advocate for your health. So that's one way. The second way we do is through the virtual health events. So we've had a Pride event, we had a Men's Health Month event, we had a COVID mental health event. Those are just some of the ones we've had this year. But those virtual events allow it to be a more intimate setting, and you can actually talk to the different panelists, and it brings a whole panel together and gives that perspective from the different areas. Then the third way is through health programs. I'm not going to speak a lot on that. We will be rolling one out soon among others. But these are the programs that are designated for certain types of patients. So for instance, you're a patient with high blood pressure and you need help managing that high blood pressure. We work with nonprofits and then state agencies to put programs in place and actually help you manage that and get healthier. So those are the 3 ways that we connect people to care.
Yeah, and that's awesome because I know, for instance, we men, we have the tendency not to talk about our health
Right.
or seen as a manly thing to keep it, quiet. But by you, going into the community and bring these issues to the fore, I think, it's a great thing that you're doing, to help the community.
Thank you. Thank you. We definitely appreciate that.
Of course, of course. So, Terrence, I was while I was preparing for this interview, I was reading an article. 1 in 7 people with diabetes ration their medication, and 56% of Americans can't cover unexpected bill of $1,000. So,
Right.
talk to us about. I know you're big on health equity. Talk to us about health equity.
Mhm. Yeah, absolutely. So, different people are at different points in the healthcare journey. All right. So you may have a great doctor that's just the same as the doctor in the higher income area of the community. But if you can't get to that doctor because you don't have transportation, there's no bus line, that's not equitable, right? So those are the types of things we try to do, is that we realize that, hey, even though there may be great medication and great resources available, do the people in certain communities, underserved communities, which are again low income, minority, LGBTQ, veteran, chronically ill, elderly, all these communities, right? Do they have the same access and ability to connect to these health resources? So that's again that gap that we try to fill. And to your point, even the prescription, drug thing, that's a major crisis. So we work with big organizations and say, hey, you have these millions of dollars out here. Well, we have a pool of 1,000 patients who could benefit from that. We'll coordinate the funding of their medication, or we'll coordinate them going to a primary care doctor visit. Just use the money for something good. And that's how we advance health equity. And then again, just by providing that access, by actually bringing the events to the communities that we serve and bringing the whole health system, if you will, into the communities directly.
So, would you say the health system is broken?
Mm-hmm. Yeah, absolutely. And that's one of the things that I kind of, my company in 2016, Connected Care, it was designed based off of that. And that's how it would start off. The healthcare system is fragmented, it's broken, right? There's no interoperability is making waves, meaning systems are talking a little better than they were, but it's not all the way there. And there's still people that are left behind. And I think we're doing, it takes organizations like ours, and yours, and I say ours, right, that are on the ground, that are actually out there talking to the people in communities and then getting them connected to care. So I do think the health system is broken. I do think we still have, one of the best health systems in the world, if not the best health system in the world here in the United States. We definitely have the resources for it and the money's behind it. But it's again, how do we make that equitable? How do we get that to everybody in the country versus just a select few?
Right, right. So, Terrence, talk to us about some of the challenges you faced in the communities.
Right. A lot. I think, one is just trust, right? There's a lack of trust in certain communities with the healthcare system just because of things that have happened in the past. The other would be from a funding perspective, right? It's very, healthcare is expensive. And when we look at the totality of care, because with us, we go after what's called social determinants of health. That's what we're ultimately addressing, which are all the factors that influence health, where you worship, where you live, your environment, the jobs that you have. All of those factors influence health more than just going to the doctor. So what we do is we go and say, okay, to address all these, we have to have the partners in place. And those partners have to be paid. So that's why it's a big thing for us to have, sponsors and create awareness, put our brand out there and tell these major corporations with these millions of dollars or billions of dollars that they have, say, put your dollars in the communities the right way. We'll coordinate that funding for you and then measure the actual impact and show people are actually getting healthier. So those are some of the big challenges that we have, and then how we see we can address them.
So, in terms of nonprofits, is any one of your businesses or your programs nonprofit related, or it's all for profit? Well, how do you? Is
Yeah, no, absolutely. And that's a great question. So that's the neat thing that we do. We're very intentional about having a community impact. So we partner with nonprofits, and as a for-profit, we have a lot of flexibility in how we can monetize things. So we partner with nonprofits to put these events on. The sponsorships that are given to the events go to the nonprofit, and then also a percentage of all the tables given back to the nonprofit. So, and then the nonprofit have to be located in the community that we're serving. So it kind of works full circle with Hight Health, because we're able to come in, work with local nonprofits and help them grow and expand, help them bring in dollars that can help advance these different programs. And then one of the other things we're working on now is with the Hight Foundation, is again, how do we fund these patients so that we have a pool of money and we can designate for 100 patients in a certain city, and then how do we make sure that that pool of money is used to get these patients back and forth to the doctor, get their visits paid for, get their medications paid for, so on and so forth.
Mm-hmm. So do you work only with like the Kaisers or the larger healthcare organizations, or you work mainly with private practices? What's the dynamics there?
Right, and so that's the neat thing about our model is, and this can be found on our website if you go to just Hight.health, www.hight.health, no.com on it, and under the For Businesses tab, you can see all the organizations we work with. But to your point, we can work with a big payer, so a big insurance company. We can work with a major hospital or healthcare system. We can work with a private practice, a community organization, a nonprofit. That just really gets down to the technicalities in the background. We have multiple models, if you will, as to how we can put the events on. But we can work with pretty much anybody, and then help in a lot of different ways.
Mm-hmm. So what's your process of selecting specific communities? How do you or where do you go? Right.
No, so that's a great one. So what we do is we use a lot of state agencies, like information from the Department of Public Health, and data sources like that, and say, okay, where are the areas with the biggest disparities? Where are the areas with the healthcare shortage? So we use a lot of the HRSA, provider shortage areas, and say, okay, well, this area has a huge provider shortage as compared to this area. Let's go into that area and then bring the provider partners that we have into this area. So now we've actually addressed the need that there are no providers in this area. Now, our ultimate goal, again, with the health events that we have in the program, that's of course a short-term fix. So our ultimate goal is to make it more long-term and be able to bring providers into the different areas, that we work in on a long-term basis. That's what we're working toward. That's how we address that and how we target those communities.
And is there an application process? Say some doctors are listening, and they're like, oh, that's great, something great that Terrence is doing in the community. How can I partner with Terrence? What's your process like that? Will they just go to your website, or how does it go?
Yeah, it is that simple. Absolutely. There's forms on our website as well. Again, it's www.hight.health. So right up here. But they can go on the website, click on the For Businesses tab, and then you can see more information. You can download our event sponsorship packet. And again, it's a win-win, whether you're a for-profit or a nonprofit organization. A doctor's office can do this as a marketing effort. They can partner with us as a marketing event for their practice and bring in patients that way. A nonprofit can, this can be an extension of their healthcare focus, and they can, generate money off of it that way. So ultimately, just go on our website, sign up there, you speak with us, speak with someone on our team. We go from there.
So in terms of the frequency of your events, how is it monthly? How often do you have your events?
Right. So last year we were having, and I'm using last year as a point of reference where we're trying to go toward. Last year we were having about 4 or 5 events per month. That was a combination of in-person and virtual events. When the Omicron variant came in, we shut down a lot of events, all of pretty much Q1, and then now we're starting to ramp those back up. So this event that's happening on the 16th from 11 to 2 in Forest Park, Georgia, on July 16th, that event is going to be our first in-person event. But when it comes to the frequency, we're trying to get to the point where we have health events every day. That would be ideal. But we have over 60 events planned out between next month and then June of next year.
Nice. That's great there. All right. So what's the structure of these events? So walk us through one of your events. People just show up, and what's the program like?
Right. So you can show up. We'll have signs out there, and sometimes have flags and all those different things. Or you can sign up online and then pre-register for an event, and you'll just be notified. Either way, we do the registration at the event. We take a quick health assessment, if you will. It's more so a health survey. Doesn't take any proprietary information, and we try to figure out what you want in your community. There may be health resources, maybe transportation resources, maybe food resources. Those may be the types of things you want. Once we've understood the voice of the people in the community, then for the next event or the future events, we can bring in those types of resources into the community to make sure that these events are catered towards the actual community. You'll get a card, and with that card, you check off, how many tables you went to. Then when you get to the food table, you just turn that in, and then you get your plate. And what that does, that allows us to track and say, okay, there were 30 vendors here, right? And people went to, these top 5 vendors. So these are vendors we need to engage and say, hey, you maybe need to have a bigger presence in the community because 50% of the people came to your vendor table. So that's basically the entire flow. This next event, again, on the 16th that I'm mentioning, will have speakers. So it's not just health events and health screenings and COVID tests, free COVID tests and screenings and all of that, but you'll also have a chance to sit with a public health professional, learn about advocacy, health advocacy, and how you can advocate for your care. So that's the basic flow, of an event. It's family friendly. We have kid-focused events that we had at elementary schools last year. So, it's just we just make it fun, and we make it, again, community oriented. And that's why we always say community health event versus just a health fair.
And that's awesome, Terrence. So on a larger scale now, and we spoke about the brokenness of the healthcare system. From where you're sitting and by having these events and really dealing with these healthcare providers, where do you see healthcare in the next 10 years? Are you seeing improvements, or where do you see that going?
I do think it's improving, and I think one of the things that happened, the pandemic exposed a lot of things, and even when it comes to the virtual health, and this is not necessarily exposed in a bad way, but exposed in a good way with telehealth. Right, it showed us that we have the capabilities of doing that, and then we can now improve that and do it well, and we can now reach more people, with telehealth. Now there's still a problem of some people being in rural areas or areas that don't have Wi-Fi, or people not having access to smartphones, which is another thing we're looking at. But overall, I think ultimately we're headed in a right direction. And I think it's everybody's saying, hey, there's going to be long-term effects, with what happened with the pandemic and what's going on with the pandemic, because I don't think we're necessarily out of it yet. But I think it's made everybody in the healthcare space say, let's rethink things, let's rethink how we do things. And it's also brought people that were outside of the healthcare field, into it and say, hey, we have solutions that are transferable from this industry or that industry, that can improve healthcare. So we're now all working together, and I see it going in a positive direction in the future.
No, and it's I'm glad that you brought up telehealth, because that's huge. And most of my clients, they're really pushing telehealth, because doctors can become more efficient because they can see multiple a larger group of patients over time than by them just physically coming in the office. And also, I could just get up one morning and see my doctor in like minutes, right? I don't have to go in my car and drive to. So it improves, or it makes things better and things more efficient. So I think that's a huge part of it.
Definitely agree.
And another thing, though, I want to bring up, and with the environment too, being remote and the whole mental side, where people are home now more than ever. So have you seen more mental issues arise because of the pandemic, or what have you seen? Because we're talking to other providers or other healthcare professionals, they see a rise in that.
Absolutely, and that's why our last 1, 2, 3 events, really, the 3 virtual events. The first one was the effects of COVID on mental health specifically, and there was a target towards the 55 and older generation. The next event was a Pride Month event, but it was, again, mental health focused for the LGBTQ plus community. And then we had the men's health event, which had a mental health individual on it. What we've seen is that mental health is now not becoming so taboo. People in communities that weren't, in the past open to mental health are now saying, hey, we need to pay attention to our mental health, because we were locked indoors for years, and most people were. So I definitely think there's a rise of awareness in mental health, and I definitely think it's something that we should be paying more attention to and should have a focus on. And then in all the events we do have some type of mental health resource, and you can go to our website, look at those past events I just mentioned as well, and download those resources or rewatch those webinars if you like.
Yeah, awesome, man, awesome. Terrence, I can't believe that we're basically at the end. Right. You are doing a wonderful thing in the community, and I know our listeners, they definitely enjoy what you're talking to us about. So I know you mentioned your website. So what are some other ways we could reach you?
Yep, so the website or social media. So at Hight Health on every social media platform, all the major ones, I guess. So LinkedIn, Instagram, Facebook, and Twitter. So those are the main four that we use. Or you could give us a call. So the number is 404-788-4429. And also we'll be have a presence now officially in Clayton County, so in Morrow, Georgia. So we'll be announcing that, and that'll be our event coming up at the end of August. So look out for more information on that. But it's on our website now if you want to RSVP for that one in advance. Because I'd love to meet everybody and see, you know, how we can work together to fix this healthcare problem that we have.
Awesome, man. As usual, Terrence, it's a pleasure speaking with you, man. And until next time, we'll talk soon.
All right, thanks so much. You have a good one, Andre.